So now we're going to get into the psoas, or the hip flexor region, going from the T12 vertebrae on the spine, all of the lumbar vertebrae, through the hips to the inside thigh. Anywhere along that region is where the psoas can be tight. Iliacus is inside the hip. The rectus femoris is another powerful hip flexor. Those three work together to bind this up. When you have that rounded lower back, posterior pelvic tilt, it's a pretty good indication the psoas is locked up. So you want to get that to open up properly so you can open the hips, you can extend the spine properly. It takes away a lot of pressure from the lower back. When you have lower back pain, most often you have tightness here in the quads and tightness in the psoas too. You can do a stretch where you lay on your stomach and you push your chest up to keep your hips down. Cobra stretch from yoga, or just a relaxing stretch where you push your chest up and drop your hips. This should feel fairly good on the front of your body, on the hip flexors. If that's not enough, for many of us it won't be, because there's tightness in here that's binding up those vertebrae. You'll need to take a ball, this is a trigger point massage ball, or marble stone, or some other device that's about 2 to 3 inches in size. You can heat or chill the marble stones, but be very careful how much pressure you put against a hot or a cold stone. You do not want to burn yourself with this freezer burn or a proper burn. So in this case, I'm going to use a trigger point massage ball and a block to support the ball so I can get into my psoas region more easily. Now your psoas runs on either side of the spine. If you put your finger in your navel, your belly button, just a couple inches to the side of that navel is a good reference point to start. The psoas tends to be thicker right about the L4 region, which is where your navel tends to be. So I'm going to lay on top of the ball with my belly button. Just to the side of that belly button is where I'm going to apply pressure to that ball. My leg is straight for the side that I'm working. My knee is bent for the side that I'm not working. That tilts my hips a little bit, puts me at a diagonal pressure point towards the spine. So as attaches at an angle to the spine, not straight back. So you want to tilt your hips just slightly to get in that angle. Support yourself on your arms, support yourself on your knees, and gradually start taking that support away with the legs, allowing your hips to sink. You'll feel that ball dig in on your abdomen. If you can breathe deeply and naturally, then you start walking your arms down. If you can't breathe deeply, don't go any lower with your arms. That psoas muscle attaches close to the diaphragm. You don't want to put too much pressure there where you can't breathe properly. Come back up to support yourself, take a little pressure off, take a breath or two. As you relax, walk your arms back out, applying more pressure. Nice, long, slow, deep breaths. If you can keep breathing deeply, go a little bit lower. Trying to get a little lower with each round. After you're down for 2, 3, 4 breaths, get your arms underneath you, support yourself again, take most of that pressure off, still have a little bit of pressure here. Take a breath or two to recover. Now I'm going to go back down again. You want to go 4, 5, 6 rounds where you go down and hold that low position. As you hold this low position, this ball is going to dig in rather significantly to my psoas. Each time that I come up and down, I'm allowing that pressure to increase and decrease. That's how you get your best address on the psoas. You apply more pressure by laying down, you take some pressure off by supporting yourself and getting almost off the ball. Once you've done 4, 5, 6 rounds or more, lift yourself up with your legs and arms, get that ball and block out from underneath you, lie down on your stomach and just relax for a moment. Shift your weight left and right. Mentally do an assessment. How does everything feel through your abs, through your spine, through your back? If everything feels normal, then fine, make your way to your feet. If it still feels funky, different, maybe something's not quite right as far as balance and so on, just shift your weight here. Make sure you normalize those muscles before you stand up. You've just applied pressure to one of the deepest muscles, if not the deepest muscle in the body. So take your time, relax. Once you feel normal, gradually make your way to your knees. Hands, knees feel fine. Knees feel fine, okay? So now I feel like I can get up, slowly make my way to my feet. Do a mental assessment, a mental checklist. How does everything feel? If everything moves like it should, take a few steps around, slowly draw that knee up, check range of motion with that hip side versus the other hip side. For the side that you just worked, you'll probably feel you can draw that knee up more easily, and you feel less tension in your back as you draw your knee up. Just work through your left side, walk around a little bit, work through right side, walk around a little bit. Gradually this tension goes down, down, down. Remember, the psoas goes from the bottom of the ribs, the T12, all the way through all the lumbar spine, the hips, and the inside thigh. It's a very long muscle. Anywhere in there can get tight. Take your time, work in methodically, starting at the navel, maybe going a little higher next time, a little lower, and working that entire region at some point, one region at a time. Good luck.